Hello, Dr. Davis. This is Group Papa's presentation. We are David, Ryan, Leah, Salman, and Deborah. We chose to exhibit how a patient's problem can be handled through the utilization of Pico. We have created a potential scenario that a dentist may encounter and will walk you through the steps of Pico.
So the P for Pico stands for the problem, and in our case study, we have a 52-year-old woman who has no previous ailments, and she is coming into the office due to complaints of her teeth being aesthetically unappealing due to tooth discoloration and staining. A possible reason for this is that she is a lifetime tobacco user and she drinks 5+ cups of coffee a day.
The I in Pico stands for intervention. An intervention is the identification of a plan of action to resolve a patient's current issues. This plan can include diagnostic tests, treatment options, recommendation of a product, or medication. Possible interventions for our patient are whitening strips, bleaching, and UV whitening. However, the intervention that we will be choosing for our patient is professional whitening treatment with a UV whitening light.
The C in Pico stands for comparative treatment. In our case study, the comparative treatment to the in-office UV whitening would be bleaching or at-home teeth whitening such as crest white strips. The in-office UV whitening intervention was selected over the comparative treatments because the entire procedure can be professionally monitored and administered in one office visit, as opposed to multiple treatments done at home with no professional supervision. The in-office UV light treatment therefore has a higher likelihood of a positive outcome and minimized risk of post-treatment tooth sensitivity.
The outcome is the final aspect of the Pico process, and it entails the effective elimination of the problem symptoms, improvement of function, and improvement of aesthetics. Here, the outcome was achieved of the patient's teeth from a shade of A3 to a shade of A1. The patient was very satisfied with this result, and consequently, this will conclude the Pico process for this patient. The next few slides show our works cited for the presentation, as well as the script that was used during this presentation.